Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare. Here is Hannah Davis.
Individuals who have been impaired by an injury or illness have a lot of questions and face an uncertain future. The Inpatient Rehabilitation Center at Cookeville Regional wants to help alleviate those fears and frustrations by providing a supportive, caring environment and always placing an emphasis on the patient's ability rather than their disability. This positive approach to rehabilitation helps instill in patients the confidence they need for an optimal recovery. Located right across from Cookeville Regional's main campus is the blue roof building that is home to the Inpatient Rehabilitation Center. This show is all about inpatient rehab and why someone, even you, may be visiting and what services they offer to help you get back to what you love doing.
The primary purpose of the rehab center is to get the patient back as independent as possible and home safely. Here at Inpatient Rehab, we treat all different diagnoses of patients: strokes, brain injuries, laminectomies, orthopedic patients. In order for us to receive a patient here at Inpatient Rehab, we need a referral. They can call, they can tell their physician, they can come by. We have all types. Once we get a referral, we go see the patient and they are admitted here. They are evaluated by physical therapy, occupational therapy. The physician sees them, the nurse practitioner, or the nurses, and then we get a plan of care.
We treat patients 18 through 99. We treat stroke patients, spinal cord injuries, any kind of orthopedic fractures, car injuries, car wrecks, that sort of thing. The therapy program is designed to adapt to whatever the patient's needs are. Each patient is assessed when they come in, and then their treatment plan is determined from what they need when they come in. They can expect individualized care. They will receive an initial assessment both by the physician or myself, the nurse practitioner, and they will also receive assessment with the therapy staff, physical therapy, occupational therapy, and depending on their needs, the speech therapist. Family involvement is definitely encouraged. Depending on the patient's need, we'll set up family training prior to them leaving to make sure that all their needs are met. If they require teaching for any specific problem, we get the family in to train them on how to do specific tasks so that when they get home, they're able to do that without any problem.
Physical therapy entails strengthening and range of motion in the legs, the lower extremities. We also do transfers, bed mobility, a lot of walking with or without a device like a cane or a walker. We work on wheelchair mobility for those that don't have the leg strength, or in our case, we have scores that we need to get for all the patients when they come in every week and when they leave, and part of that is the wheelchair mobility. For a patient with strokes, it can be really difficult because they might not have real good use of one of their arms or legs, but we try and help them to do that the best way they can. With inpatient rehab, what we do is really focus on function. We have people with all different types of diagnoses, from strokes to head injuries to hip or knee replacements, ankle fractures. So we have a nice variety, which is the best part about working here, is that there's always something new and different. Every day is a little bit more exciting than the next one. And a lot of what we'll do is work on getting them more independent so they can go back home. So from day one, the focus is on function. What do they need to do in order to get home and be safe with their mobility?
Occupational therapy is here to improve a patient's independence in their activities of daily living. Typically here what we deal with is independence in bathing, dressing, toileting, eating, grooming, bathing, just anything that's important to the patient that they do at home on a regular basis. And we're here to make them as independent as possible before they go home. We do that in a variety of ways. We can assess and improve cognitive functioning, physical functioning from an upper extremity perspective. And we just typically improve that no matter what the problem area is or what diagnosis they have. And we work on that to improve their overall function and help them return home that way. I love working at Inpatient Rehab Center just because it's so rewarding to see patients come in at a low level, not be able to take care of themselves in the way that they were, be having such a physical or cognitive dysfunction, and be able to just watch them rehab and get back to a normal, independent lifestyle.
Speech therapy is therapy that you work with a patient, making sure that they can understand what's being said to you, making sure that they can express to you what they want to say, any ideas, any thoughts, any basic needs. I work on things like memory, making sure that you can understand and keep up with what's being said, day-to-day information, making sure that you can chew and swallow your food safely. Depending on what the diagnosis is, we'll work on things, answering what questions, answering what did you do today, what did you do yesterday. I make sure if they have trouble chewing or swallowing, we'll do oral motor exercises. We'll practice chewing on certain foods and swallowing different liquids and making sure that it's safe for you to tolerate and you can chew and swallow and eat just like any normal person would. We'll play games and kind of incorporate the exercises or the tasks that we'll try to target, make it more fun for the patients, just depending on what their age might be. Yeah, we do a little bit of everything. We go outside, we'll stay in here, we'll go to their room, just making it work for that individual patient.
I had bilateral knee replacement on May the 20th. Before surgery, there was a lot of pain in the evenings, later in the day, stiffness when I'd get up in the morning. After I would work my 12-hour shifts here at the hospital, pretty much I would be in a chair the rest of the night with the pain and the swelling in my knees. Yes, I did choose inpatient rehabilitation here at Cookeville Regional. I came out and visited. I visited with Teresa Boynton. She came, took me around the facility, showed me the room, showed me the rehab area where I'd be doing the exercises and the physical therapy and the occupational therapy that we would do. So I had a good tour, and that made a big difference in me deciding to come here. I did tour other facilities in Cookeville, and I just was not as satisfied with them as I was here. My experience here at Cookeville Regional Rehab, Inpatient Rehab, was fantastic. They attended to every need that I had. The nursing staff, the support staff that helped to even bring her food, our nursing assistants, anything that I asked for, they supplied for me. I think that the reason I'm just 4 weeks and 3 or 4 days post-surgery, and I really feel that the reason I'm doing so well now is because of the rehab experience here at Cookeville Regional. I feel like that gave me a fantastic start to getting ready to walk on my own again. I really believe that coming here and spending that week really helped me. I think that everybody needs the inpatient rehab. You have a physician that is readily available for any problems that you have. You have nurses, instead of your home family, you have nurses that can check on you and make sure that everything is okay. I really recommend coming. I think it's made a world of difference in me.
I had a stroke. Yes, I did. I come here. So I had a choice which one to come to, and I chose Cookeville Regional. I'm lucky to have the nurses and the care at the hospital. I'm lucky. I just love the nurses and the doctors that took good care of me. Good, they were awesome. The nurses took excellent care of me. They were so good to me. They helped me. There wasn't nothing they wouldn't do for me. They made me feel like I was #1, and they took excellent care of me. They helped me walk. I couldn't talk. I was weak. I was wobbly. It was bad. It was bad. I'm lucky I'm alive. I'm a survivor. I'm going to do good, and I am doing good. I don't want to be left without a voice. I could barely talk. Now I'm talking back at my old self. I'm just doing great. I couldn't have done it if I hadn't come here. Yeah, how now, brown cow? Yeah.
The Inpatient Rehabilitation Center is truly helping people like you and me get back to what we enjoy. To learn more about the Inpatient Rehabilitation Center, call 931-783-2850. Thank you so much for watching. Your health does matter, and we hope that you continue to stay healthy and happy.
Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare.